afternoon. My name is Michael. I'm going to be your student practitioner. I'm going to do a head-to-toe assessment on you today. Is that going to be okay?
Yes,
And your name is Tatiana?
correct.
May I address you by that name,
Yes.
Tatiana? All right, I'm going to go wash my hands so we can begin. I wash my hands. First, we're going to start off with head and face, and I'm going to inspect your skin.
Mm-hmm.
I'm looking for color changes, temperature, any swelling, edema, texture, and looking for scarring, any nevi. And if there is, I would document that for future reference. Next, I'm going to assess the patient's skin. And I'm looking for any lesions, any infestations of lice, anything. Next, I'm going to go and assess the patient's temporal arteries, checking for tenderness. Next, I'm going to move over to checking the patient's lymph nodes, preocular lymph nodes, postocular lymph nodes. I'm going to check the occipital lymph nodes. Then we're going to go to tonsillar lymph nodes. Then the submandibular lymph nodes. Then the submental lymph nodes. Then we're going to go to the anterior cervical lymph nodes, posterior cervical lymph nodes, and then supraclavicular lymph nodes. Next, I'm going to assess the patient's cranial nerve 5, and I'm going to palpate her masseter muscles while she clenches and assess if there's any tenderness to that area. Next, I'm going to assess patient's cranial nerve 7. I have the patient raise her eyebrows. All right, can you smile? All right, and can you puff out your cheeks? All right, and then we're looking for symmetry. Trying to rule out a Bell's palsy or a possible stroke with the patient. Next, we're going to move on to the patient's ears. And I'm going to assess the patient's ears, looking for symmetry. See if they're symmetrical and everything is good. Next, I'm going to assess patient's mastoid process, and I'm going to inspect, palpate, and percuss. I'm looking for redness, any symptoms of infection, any tenderness to that area.
No.
Do the left side. Any tenderness to that area?
No.
And then next, I'm going to inspect the patient's pinnae and tragus area per ear. And we're looking for any masses to this area, any tenderness. Try to rule out otitis externa. And we'll do that to the left ear. Palpate the pinnae and the tragus. No, that was fine. Next, we're going to move over and assess patient's cranial nerve 8. I'm going to start by doing the whisper test. And I'm going to say a number and see if she can hear it. 99.
99.
Excellent. 99.
99.
Excellent. Successful on the whisper test. Next, we're going to do the Weber test, and we're assessing for lateralization with the Weber test. I'm going to use my simulated tuning fork here. I'm going to put that on the patient's head. I hit it, and I'm going to ask her if she can hear that on both sides.
Yes.
All right. Next, we're going to do the Rene's test and assess her hearing for AC and BC, bone conduction and air conduction. And I'm going to do that. Are you able to hear that?
Yes.
And then the bone conduction. Are you able to hear that?
Yes.
Alright, which was louder? AC was louder?
Yes.
Make sure that the AC is louder than the bone conduction. Hit the tuning fork. Are you able to hear that?
Yes.
And then on her. Are you able to hear that?
Yes.
And the AC was loud?
Correct.
Next, oh, we should keep that on this one. Next, I'm going to check the patient's ear. And I'm going to check the ear canal first in the patient's ear. Oh. Wait. And for the canal, we're just looking for swelling, any debris. We're checking for earwax, trying to rule out any infection in her ear. Canal looks good. Left ear. And the canal looks good as well. And I'm gonna check her tympanic membrane. And that looks good. I did see pearly gray with a reflection at 7 o'clock. And here the same, pearly gray with the reflection at 5 o'clock. Next, we're gonna move on to her patient's eyes. And first I'm going to assess patient's eyebrows, eyelashes, and palpebra fissures. And I'm looking for symmetry. And that looks good. Next we're going to move over to the eye exam. And first we're going to use we're assessing the cranial nerve 2. And first we're going to start off with a visual acuity test. And I'm going to have the patient cover her right eye. And can you see that?
2.
Alright, can you cover your left eye? And what is that?
1.
Alright, next we're going to do the visual fields by confrontation. And this is assessing patient's peripheral vision. And I'm going to have the patient cover her right eye. And what number am I holding up?
2.
Okay, can you do the same on that side? And what number am I holding
1.
up? Right. Right, and next we're going to move on to visual popularity test. Direct and consensual popularity to light test. Excuse me. And we're going to do this. I'll use this. Alright. And I did have a reaction there. And then I'm going to do the consensual. And both pupils did react. So was positive test there. She passed that test. Next we're going to do accommodation and conversions. And again, we're assessing cranial nerve 3. And accommodation did have our pupils did constrict. Now I'm going to do conversions. And I did get a positive conversions on her bilateral eyes. Next, we're going to do the conjugate gaze and extraocular movement. And that's assessing cranial nerve 3, 4, and 6. And I'm going to stand close to the patient here. I'm going to have her look directly at me and follow my finger up, down to the right, down, and then we're going to go up here, up, down, and she passed that. So we're gonna move on over to the optic disc. I'm gonna assess patient's optic disc. I'm gonna come in at a 50-degree angle. Can I get you to look straight ahead? Yeah, I did get the red reflection. I was able to see the atrial and all in the venous. And the same here. I did get the red reflex and everything looks normal with that test. So moving on, we're gonna move on to the patient's nose. I'm gonna assess the patient's nose by make sure it's midline and it's straight. And that looks good. And I'm gonna assess her septum, and that looks good. And the mucosa, that looks good. And the turbinates. Next, I'm going to assess cranial nerve 1. And I'm going to have the patient cover her right nostril and breathe in. And then do the same with the other. Cranial nerve is functioning properly. Next, I'm going to assess the patient's TMJ. I'm going to assess the maxillary sinuses and the sinuses here. All right. Next, I'm going to move on to the patient's mouth. And yeah, I'll need that. I'm going to assess the patient's teeth, gums, tonsils, the bottom of her mouth, and the bottom of her tongue, and the salivary glands. All right, can you raise your tongue up, please? Thank you. All right. Then I'm gonna inspect the square. Nice. The square. Good job. Next, we're gonna move on to assess patient's TMJ. Can you move up and down? Thank you. And we're making sure there's no tenderness to that area. Next, we're going to move on to cranial nerve 9 and cranial nerve 10. And I'll have the patient open again. And I did see the soft palate and the uvula raised at the same time. And is any changes with your voice at all? So she's having no problems in this area as well. Next, we're going to assess cranial nerve 12. And can you stick out your tongue? All right, can you place your tongue against your cheek? And the other side. All right. And we assess cranial nerve 12 with that one. Next, we're going to move on to patient's neck, and I'm going to assess the trachea. Palpate, make sure that's midline. And next, I'm going to move over and assess her thyroid gland, the back and the front. Right. Next, I'm going to palpate the right carotid artery and the left. Yep. And I'm gonna listen to rule out bruits. And then next I'm going to have the patient, we're going to test range of motion to her neck. And I have you move your neck to the forward, backward, to the side, and to the other side. And then we're gonna test cranial nerve 11. That's the spinal accessory nerve. And I'm gonna have the patient move her, shrug her shoulders. And she was able to do that. So now we're gonna move on over to the posterior chest wall. I'm gonna have the patient stand up. And we're gonna assess the patient's chest, posterior chest and lungs. Right now I'm assessing the skin, looking for color changes, any temperature changes, any symptoms of infection to the area, checking the texture of the skin, and any bruising, any scarring, any lesions, and any nevi. And we will record those as we see fit for future reference. Then now I'm going to assess the patient's structure, and that looks good. Next, I'm going to inspect and palpate the spine. I'm going to inspect and palpate the scapula, then the shoulders, and then I'm going to assess for muscle definition, which looks good. Next, we're going to inspect, and then now I'm going to assess the patient if she's in any symptoms of respiratory distress, and she looks looking for any nasal flaring, any symptoms of cyanosis, any nasal flaring. I did say that. Yeah, I should have done that first. Now I'm going to assess patient's respirations, checking for gap, excursion, make sure it's a regular rate, and then I'm going to ask to see if are you wheezing at all?
No.
Any shortness of breath?
No.
Okay. Next, I'm going to move on to assessing the patient's symmetry, and I'm going to have her take a deep breath. And that was symmetrical. Both of my thumbs moved evenly from her spine. Next, I'm going to palpate for fremitus. I'm going to have the patient say 99.
99, 99, 99, 99, 99.
All right, so we have fremitus equally throughout. Next, I'm gonna auscultate. Give me a second. I'm trying to remember. I'm gonna palpate. I'm gonna percuss for the left posterior. Next, I'm going to percuss for diaphragmatic excursion. And I'm going to have the patient take a deep breath. And we have an area of dullness there. Now I'm going to tell her to take another, relax. Now take another deep breath and exhale and hold that. And another area of dullness. And I'm going to measure, that's a normal measurements of 3 to 5 centimeters. And we're going to simulate that. I did this side, and we're going to do that. Then percuss, take a deep breath. We have dullness. And then can you take another deep breath and blow out and hold it? And there's dullness again. So, and it was equally 3 to 5 centimeters. Next, I'm gonna auscultate patient's lungs. Deep breath. And then next, I'm gonna listen to the lateral sides of her lungs. Deep breath. Deep breath. Yeah. Finally, I'm gonna listen to the right medial lobe. Deep breath. Okay. And then next, I'm gonna assess the patient for cacophony, echophony, brachophony, and whispered soliloquy. Pectroliloquy. Gonna have the patient say beat.
Beat, 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 beat.
And that all came out as an E. Next, I'm gonna have the patient say 99.
99, 99, 99, 99, 99, 99, 99.
And that was the brachophony test. Finally, we're gonna do the whispered pectroliloquy. Let's say whisper 1, 2, 3. Right. And that was a negative as well. Finally, I'm going to assess the patient's CVA, and we're assessing for possible symptoms of a kidney infection. And I'm going to palpate that. Any pain to that area? No? Any pain?
No.
All right. So we're done. I'm going to have the patient turn around. And I'm going to assess her anterior chest wall and lungs. Again, we're assessing the skin, trying to rule out any symptoms of skin infection, recording the nevi if they're irregular, even if they're irregular, recording for future reference, and assessing for hydration as well. Then I'm assessing the symmetry of her chest wall. Next, I'm going to palpate for symmetry, and then we're going to palpate for fremitus. Take a deep breath. And that was equal. And get you to say 99.
99, 99, 99, 99.
All right, so that was symmetrical in both, so we're done with the anterior chest wall. Now we're going to move on to cardiac, and I'm going to listen to the patient's heart. Aortic, pulmonary, Erb's point, tricuspid, mitral. And then we're going to do it with the bowel. And then I'm going to inspect and palpate inspect the PMI. And all right, I got that. And then I'm going to listen to the apical pulse. Okay. And then I'm going to have the patient lie down. assess for heaves or lifts. Yeah, and she seems to be breathing normally. Next, I'm gonna palpate the areas that I auscultated. Now I'm gonna listen to those same areas, the apical, aorta, the pulmonary, varus point, tricuspid, and mitral. I'm gonna use my bowel now. Next, I'm gonna assess the patient for regurgitation, atrial regurgitation. I'm gonna have her sit up. And I need you to lean forward. That way we can get that part leaning forward. And then I'm gonna go midline and listen. All right, thank you for that. And then I'm gonna assess the patient for mitral stenosis. I'm gonna have her lay on the left side. Okay. Oh, that's with the bowel, I'm sorry. Thank you. And then finally, we're gonna assess the JVD to the patient. And I'm gonna simulate that she's at 30 degrees. And we're assessing those jugular veins and no distension at all. All right, so we're done with the cardiac. Now we're gonna move on to the abdomen. I'm gonna assess the abdomen, same. I'm gonna look at the skin color, ruling out any color changes, any temperature changes, any edema, extra moisture or swelling to the area, the texture trigger and bruising, any lesions, and any nevi, and then we're going to document those as we will, and then for future reference. Now we're going to assess the contours and the symmetry to the abdomen as well. And then I'm going to move on, and then I'm going to auscultate. And auscultate the aorta, renal arteries, iliac arteries, and femoral arteries. Okay. And then next, I'm gonna auscultate her bowels. Do all 4 quadrants. Okay. And next, I'm gonna lightly palpate her. I'm gonna do deep palpation to all sides. And then I'm gonna palpate the liver and assess the liver at the right costal space. And it normally is 1 centimeter below. Anything larger, then I would, insinuate that we have an enlarged liver there. Then I'm going to assess palpate the spleen, which shouldn't be palpable. And then I'm going to palpate the aorta. And then I'm going to come down and palpate her lymph nodes, inguinal lymph nodes, and then her femoral lymph nodes. And then I'm going to move on to percussing. Now we're percussing for tympani. Then I'm going to percuss the spleen, the tribe space. And I'm going to start at the mid-axillary line and work my way down. And there's no area of dullness there. Next, I'm going to assess the patient for cholecystitis and assess that Murphy's sign. And I'm going to have the patient take a deep breath. And I would press down on that. And as soon as I press down, if that was a positive sign, if she did, she would experience some pain, significant pain to that area. Next, we're going to assess the patient for peritonitis. And we're going to start off with McBurney's point, which is 1/3 away from the iliac crest to the navel. And we would do that with some deep palpation and rebound. And I would go and let that go. And if it was a positive sign, the patient would have some discomfort to that area. Next, we're going to do the psoas maneuver. And I'm going to have the patient lift her right leg. And with resistance, she would have pain if she was having some peritonitis there. Next, we're going to do the obturator maneuver. And I'm going to have the patient again move her leg up. And I'm going to rotate that inward. And she would have pain if she did have some peritonitis. Then finally, we're going to do the Rothstein maneuver, where I apply pressure to the right lower quadrant, and she's going to get some referred pain to that left lower quadrant if she's got some peritonitis. Alright, so we're done with the abdomen. We're going to move on to musculoskeletal. And I'm going to start with the upper extremities. I'm going to assess the patient's, inspect and palpate the patient's fingers. I'm ruling out any redness, any swelling, any discomfort, tenderness, deformities, nodules to this area. And then I'm going to have, fingers. I'm going to check for capillary refill. And that's positive. Then I'm going to check her radial pulses. And then I'm going to check her skin. Again, I'm going to look for the color, temperature, moisture, extra moisture, texture, edema, and then we're going to look at bruising, scarring, any nevi. Next, we're going to move on to range of motion to her fingers. Okay, and then hand grips. Can you? Yep. And then I'm going to assess the patient's wrist. Yeah. I'm going to assess her and palpate her wrist. And that looks good. Range of motion. Can you do range of motion with your wrist? Thank you. Next, I'm going to move on to let's check the strength. Can you move up? All right. And down, up, down. All right. Next, I'm going to move to her elbows and inspect and palpate her elbows. And good. Again, looking for any swelling, redness, tenderness to those areas, any nodules. Next, we're going to assess, this range of motion to the elbows. Yep. And then I'm gonna assess the strength to her biceps and triceps. And then I need you to pull up. Okay, that's good. This one the same. And then push up, push down, and then push down. All right. Next, we're gonna move on to her shoulders. I'm gonna inspect and palpate her shoulders. Again, looking for redness, swelling, anything of that sort, any nodules, any temperature changes. Then we're gonna do range of motion. If you can move your arms up, shoulders, and then yep. And then I'm gonna test her strength. Push up, and then yeah, that's good. All right. Then I'm gonna do skin sensation test to her upper extremities. Are you able to feel all that?
Yes.
Can you feel that?
Yes.
All right. Next, let me get a sip of water. Next, I'm gonna move on to the cerebellar coordination test. And I'm gonna have the patient follow my fingers and tap my fingers. Can you tap this one? Oh, with your other, yep. Yep, there you go. And the same here. And she has some coordination there. Next, I'm gonna have the patient flip-flop her hands. And then I'm gonna have the patient touch her fingers like this. Yep. All right. So we're gonna move on to the lower extremities. Oh, okay. No. We're not. We have to. Shoulders, fingers, deep tendon reflexes. We're gonna do deep tendon reflexes. So I'm gonna assess the patient's brachial radius, and I'm gonna assume and simulate that we have a hammer tuning hinders, and I'm gonna check her. Yep, positive reaction, and we're gonna check her bicep. And then we're gonna check her tricep. All right, and then I will do that on the other side. Next, I will do her patella. Oh, that's pretty good. And then we'll do the Achilles. And then we'll do the Butvinsky. And I did get, everything was positive with that. Now we're gonna move on to the lower extremities. I'm gonna, what happened here? Oh boy. I'm gonna assess the patient's toes and inspect and palpate her toes, looking for any redness, tenderness, any swelling to her toes. Next, I'm going to do the range of motion with her toe. And then we're going to do capillary refill. Okay. Next, I'm going to check the pulses, dorsopedius pulse. I'm going to check the popliteal pulse. And then I'm going to check the posterior tibia pulse. Then I'm going to inspect the patient's skin, make sure it's intact, assessing for any edema, any redness again, and that looks good. Next, we're going to move on to the patient's ankles. I'm going to inspect and palpate her ankles.
Move.
Yeah. Palpate her ankles, range of motion in her ankles, and then strengthen her ankles. Then we're going to move to the knees. I'm going to inspect and palpate her knees. And then I'm going to assess for strength. There you pull down, up, and then down. Yep. And then I'm gonna assess the strength in her hips. And we're gonna do that by abduct, no, you say, yep, thank you. Squeeze, and then push out. All right. Then now we're gonna assess hips. I'm gonna assess sensation are you able to feel that?
Mm-hmm.
To lower extremities. And then I'm gonna assess with my simulated tuning fork. I'm gonna vibratory sensation to her malleolus. And you're able to feel that?
Yes.
All right, and I'm gonna do that to that side.
Yeah.
All right. Let me see. And then get you to stand up. Next, we're gonna do range of motion to your hips. Inspect the hips. And palpate the hips. Range of motion, the hips. Okay. Thank you. And then we're gonna move on to the knee. Range of motion in the knee. Range of motion in the knee. Then we're gonna do the spine, if you can turn around. Inspect and palpate the spine. I'm gonna have her bend over, range of motion to the sides, bend over. Then I'm gonna assess for scoliosis. And then I'm gonna have the patient, we're gonna do the test. We're gonna do the Romberg's test. Close your eyes into your sides. Put your heels together. She's not swaying at all. Now we're gonna do the pronator drift test. Hold your hands out straight. Close your eyes. Count to 20. Count down from 20.
20, 19, 18, 17, 16.
No swaying, okay? Now we're gonna check the patient's gait. If you could walk. All right. All right, and if you could walk on your heels. If you can walk on your toes. And you can walk heel to toe. All right. And then I'm going to have the patient squat and then jump on one leg. All right. And that completes her head to toe.